Welcome to the presentation of the Infrastructure of an Informatics Department, Nursing 353 Information Management and Healthcare at Jacksonville University. My name is Michelle Bigg. Also included in this presentation are team members Heaven Harper, Bonnie Keating, Greta Lawrenston, and Lisa Mack. The infrastructure of informatics is the underlying foundation or basic framework requiring nursing leaders to understand, promote, own, and measure the success of healthcare information technology. Health informatics is the interdisciplinary study of the design, development, adoption, and application of IT-based innovations in healthcare services, delivery, management, and planning. There are some building blocks of the informatics department that are important with your system. Informatics is defined as the science and art of turning data into information. And nursing informatics is the act of combining information and computer technology to support nursing practice and the ability to provide direct patient care, administration, education, and research incorporated into electronic medical records and documentation. There are 4 levels of nursing informatic competencies. These include the entry-level nurse, experienced nurse, the informatics nurse specialist. The entry-level nurse is a novice nurse who has basic computer skills and abilities to use desktop applications and electronic communication. The entry-level nurse must know how to collect patient data and put it into computerized records. The experienced nurse builds upon the entry-level knowledge, incorporated evidence-based practice into their nursing practice, and the ability to document it. The experienced nurse is proficient in the use of their computer programs and can work with the informatics nurse specialist to improve electronics documentation. The informatics nurse can support all areas of nursing practice, including research, project management, system designs, and development and analysis. They can also provide support, maintenance, and evaluation of software programs. They also can help with multidisciplinary implementation of language to support standards of practice. They are critical thinkers who can manage data, support the creation of systems, and have higher level computer skills and competencies. The informatics nurse specialist is a culmination of the previous 3 competencies. The scopes and standard of nurse and informatic practice indicates the need for higher levels of education with regards to research and theory. The informatics nurse specialist can not only be a project manager, but also an administrator. The informatics nurse specialist also has a higher understanding and educational base of computers and technology. The main component of the informatics department is a computer. A computer is an electronic device that is used to collect, input, and manipulate data. It includes the inputting device, which is the physical pieces of the computer that allow the user to put information into the computer. The keyboard, mouse, touchscreen, and microphone are some examples of the inputting devices. The CPU, or central processing unit, is the brain of the computer. The CPU is the electronic piece that ties inputting, storage, and outputting together and makes it all work. Primary storage is within the CPU, known as ROM, or read-only memory, and RAM, or random access memory. ROM is permanent storage in the computer when it is powered down, and RAM is only temporary storage while the computer is on. There's secondary storage, which is an external or separate storage device such as USBs, CDs, DVDs, and hard disk drives. Information is transferred onto these devices, then the devices can be removed with the data safely on board. There are also outputting devices that allow the user the ability to see or hear the information. Examples include printers, speakers, monitors, and projectors. Another building block of informatics department is standardized terminology. It is a clinical dictionary of medical terms. It is a global attempt to eliminate slang and unapproved terms, abbreviations, anagrams, providing universal consistency within not only departments but across line to other facilities worldwide. It is necessary to standardize terminology so that the electronic health records can exchange data universally, clearly, and concisely. The purpose is striving towards better healthcare globally, increasing patient safety, education, treatments, and most importantly, patient outcomes. Some of the major benefits of standardized terminology is decreasing patient costs by reducing double testing. It increases efficiency within nursing, and these together help to cut organizational costs. There are clinical guidelines that help with the standardized terminology that include the Healthcare Information Management System Society, the World Health Organization, which is created by the International Classification of Disease, the Unified Medical Language System, which was created by the National Library of Medicine Vocabularies, the American Nursing Association, or ANA approved nursing terminology, and the American Medical Association that uses the Common Procedural Terminology System for billing and reimbursements. Some of the building blocks of the informatics department include the chart below. The healthcare information systems is included of the clinical information systems and administrative information systems. The clinical information system includes the nursing information system, monitoring system, order entry systems, laboratory systems, radiology systems, pharmacy systems, and other ancillary systems. The administrative information systems include the client registration systems, financial systems, payroll HR systems, risk management systems, quality assurance systems, contract management systems, and scheduling systems. All these systems appear to be standalone systems, but in some cases they may be, but strong information technicians and nursing informatics specialists work feverishly to create seamless transition from one system to the next. As these systems communicate with one another, they share information in order to further meet criteria again for meaningful use, and once again striving to improve care provided to patients and improve outcomes. The impact of informatics on healthcare include patient safety. The World Health Organization defines patient safety as any system, design, or intervention that has demonstrated the ability to prevent or mitigate patient harm stemming from the processes of healthcare. In 2004, the World Health Organization launched the World Alliance for Patient Safety in response to the World Health Assembly resolution urging the World Health Organization and member states to consider the problem of patient safety. Then the Institute of Medicine included recommendations for the use of IT to prevent adverse drug reactions, inappropriate doses, potential side effects, and other types of mistakes. There needs to be transparency in healthcare, which is helped by online report cards. These are documents that contain evaluated care data of individual physicians, facilities, health plans, and other care providers, serving as a tool to help healthcare consumers by allowing them to compare the quality and other characteristics of providers and health plans. Another impact is error reduction, which is focused on patient identification. The Joint Commission required organizations to investigate and plan for technology that could assist with the process of positive patient identification when it designed improving the accuracy of patient identification as a potential national patient safety goal for 2008. Then also information technology safeguards. When used properly, technologies such as automated drug dispensing systems, smart IV pumps, electronic medical records, computerized documentation at bedside, barcoding, and computerized physician order entry reduce adverse events through the introduction of additional checks and balances to existing systems. The computerized physician order entry benefits including the reduction in transcription errors, a decrease in elapsed time from order to implementation, standardization and more completeness of orders, fewer medication errors, the ability to incorporate CDs, alert for critical lab values, and prompts when certain tests are due. But it is noted that CPOE is a tool and not a guarantee. Also, e-prescribing has associated advantages including fewer errors, improved communication, greater efficiency, improved compliance with recommended treatment guidelines, lower cost, and less time to refill prescriptions. Barcode and RFID medication administration. The FDA issued a rule in 2000 for requiring barcodes on most prescription and some over-the-counter medications as a means to decrease medication errors. Barcode technology automates the storage, dispensing, returning, restocking, and crediting of barcoded medications, improving safety by ensuring that the right medication is dispensed to the right patient, particularly when used with barcoded ID bands. This is frequently referred to as BCMA. There's also an impact with increased efficiency. There's smart technology that is integrated and helps to save time and physical burdens that improves patient outcomes. It is a system that optimizes workflow efficiently by resolving real problems and ties multiple electronic solutions together to create seamless workflow for the clinician at the point of care. Smart technology enhances quality by reducing opportunity for error, prioritizing and reminding caregivers of the tasks that need to be completed, and allows for real-time documentation of tasks at the point of care. Real-time documentation also reduces steps for staff by eliminating the need for movement from patient room to a computer. This documentation model also eliminates the opportunity for transcription error when clinicians enter information into the EMR, which may be noted on a piece of paper at the point of care. There's also an impact of regulatory agencies on informatics. Each state has its own health agency, which is the principal regulator of healthcare services for that state. The agency delegates the various health-related responsibilities to other agencies. The Healthcare Finance Administration is responsible for overseeing any grievances involving Medicare recipients, but consumers who have complaints against Medicaid, HMOs, PPOs, POS, and other insurance plans must first seek assistance at the state level. The Joint Commission provides accreditation of healthcare organizations and related services to ensure that safety and quality standards are met. There are informatics solutions that help with the process. Nursing practice helps to improve documentation of assessment on patient. It helps to enable nurses to access test results in a timely manner and ensures the privacy and security of electronically shared documents. The informatics system also helps physicians with easier order entry with increased accuracy, the ability to review patient medication history and allergies before ordering, alerts for any medication interactions, and electronic prescription submissions for both the outpatient and inpatient setting. It also helps the lab, pharmacy, and radiology departments. There'll be a shorter turnaround time for results, automatic drug dispensing systems. It helps to prevent the duplication of orders, which helps to decrease cost and patient risk. Abnormal results are generated according to age, sex, and hospital standards, which can help in the patient's care. Automatic generation of specimen labels, which can help decrease time of writing labels and also writing the wrong tests that need to be performed. Scheduling of diagnostic tests, and also electronically transition of radiology films through a PAC system, which can be seen across the institution as well as being made into CDs that can be brought to other institutions. Also, for medical records, it helps to improve organization of client records. Physicians, nurses, administrators are able to see the different visits that each patient had and make sure that the correct processes are being done on them. And it helps to eliminate the cost of supplies, including paper, printers, and ink. It also helps the administration. It helps to provide various levels of security. It also helps to improve compliance for HIPAA regulations. It helps to provide auditing utility that can be used in the institution and dashboard reporting capabilities. Informatics has a great future ahead. The Informatics Institute of Medicine states that the informatics nurse must design a healthcare system that produces a safe, effective, patient-centered, timely, efficient, and equitable care. Nurses comprise of the largest segment of our nation's healthcare workers, which is over 3 million members, and we really do have a stronghold on to the medical community. We can help to achieve objectives in the 2010 Affordable Care Act, and barriers prevent us from being able to respond effectively to changing healthcare settings. In 2008, the Robert Wood Johnson Foundation, including the Institute of Medicine, launched a 2-year initiative to respond to the needs assessment and transform the nursing profession. And through its efforts, the committee developed 4 key messages: that nurses should practice to the full extent of their educations and training, nurses should achieve higher levels of education and training through an improved education system that promotes seamless academic promotion, nurses should be full partners with physicians and other healthcare professionals in redesigning healthcare in the United States, and effective workplace planning and policy requirements for better data collection and information structure. In the future, the nurse is going to have a lot of main focus on the informatics system, including the health record usability. They're going to help with the adoption of healthcare records due to understanding the workflow. They're going to be able to help design software that is usable by clinicians. They'll be able to participate in usability evaluation, which includes testing and assessing the clinical application. They'll be able to improve healthcare delivery through the design and use of informatics solution, and will be able to help guide electronic health records The success of the healthcare IT system is going to include information infrastructure, needs the nurse leaders to understand, promote, and own and measure the success of the healthcare IT system. Education, which is going to include faculty and nurse executives, competencies, which include nurse leadership, sharing best practices of the healthcare IT, which improves quality and delivery of nursing care, and also magnet recognition programs, nursing excellence through technology, and improve patient outcomes. The vision for nursing informatics is going to be predicated upon quantum computing. There's going to be multiple operations simultaneously providing faster manipulation of information and deeper analysis. The nursing is going to shift from e-care to mobile care, M-care. And Moore's Law states by the year 2047, computers will be 10 billion times more powerful than today, and we're going to be able to use voice, facial, and gesture recognition in the future. As Bill Gates has said, the best is yet to come. In the face of these sweeping changes, nurses must be able to humanize the use of technology using a nursing model. And in conclusion, the infrastructure of an informatics department is very important. You must have infrastructure of informatics, the building blocks of the informatics department, impact of informatics on healthcare, informatics solutions, and the future of informatics and technology when considering the infrastructure of the informatics department in the future. The following are our references.